Are you frustrated and overwhelmed by your child's tantrums? The behavior is instant, and most of the time it catches you off guard. As a result, your relationship with your child is unpleasant. Yes? Yes. The struggle is real, and I want to reassure you that you are not alone. Tantrums have been proven time and time again to be a parent's biggest parenting struggle, one that is experienced by most parents. As a parent coach, I can attest to this, and as a mom to a 4-year-old, I can attest to it as well. And whilst the tantrum have subsided a little bit, we have come a long way. And so this video is to help us understand what tantrums are and the common causes of tantrums. Hello, 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 my beautiful people. I'm Conscious Togo, and this is our Conscious Parenting platform. So, to start us off, let's define what a tantrum is. Tantrums are basically a child's way of letting you know that they are having a hard time managing their emotions. Tantrums are also known as big feelings. And when you think of it in that sense, you are then able to better understand your child, and you are able to be there in a much better way for your child, and you are able to be compassionate towards your child. Tantrums often play out as anger and distress. So first starts the anger, which then subsides over time, and then what's left is the distress, which then plays out in a form of crying, and it comes with a lot of sadness. And usually this then signals that your child just needs a lot of comfort. The display of tantrums differs from child to child, and of course, it differs from the actual situation. But for the most part, it plays itself as screaming, aggressive behavior, turning red, destruction of property, and vomiting. Now, we have gotten to a point where we understand a little bit about what tantrums are. Maybe now this would be a good time to then move on to tantrum causes, or what we call triggers. If there's anything that I want you to take away from this video, is that tantrums for the most part are a normal part of development, especially when you consider the ages between 1 and 3, because at this age, this is when they are at their peak. After 3, they usually tend to subside. However, if your child's tantrums are yet to subside, I don't want you to get into a panic. All this says is that your child needs a little bit more time to understand, to process, and to communicate in a healthy manner. So usually I then encourage a lot of parents to be understanding and to be gracious towards children, because when you think about it, if you didn't know, us as adults, we too have big emotions. So we should be more understanding towards our children based off the fact that we as well have big emotions. So tantrums are a normal way of development for this reason. The first one is brain development. So the part of the brain which is called the frontal lobe, which is by the forehead, is still developing. And therefore, the frontal lobe is usually responsible for impulse control, rational decision making, problem solving, seeing other people's point of views, and the ability to compromise. All of this is still developing in young children. So when you find children who are expressing themselves in an intense manner, they are most likely operating from their emotional brain, which is called the limbic system. It's called the limbic system. So, what else is important to note about tantrums? This is still within areas that are still developing. One is that this is a form of communication. So tantrums are a form of communication. This is how your child will express to you what they want and what they don't want. This is also a way in which your child will express to you their likes and dislikes. This is also a way your child expressing to you what they need and what they don't need. This is a stage where your child is looking for healthy ways to gain control and autonomy. So, this is a point where they're gaining independence and they are learning that they are separate beings, separate from the caregiver. It's also a beautiful and empowering experience for them. And for the most part, what they want to do is they want to grab every opportunity that they get to influence their environment to ensure that their needs are met. The other point is that their language is still under development. At this developmental stage, they lack the ability to communicate their thoughts and to communicate their feelings. So they are still learning how to communicate in a healthy manner and not with intense emotions. They are also in the process of learning to regulate their emotions. And this is a skill that is learned over time. Emotional regulation happens over time. It doesn't happen overnight. So, the second part is that the causes of tantrums is pretty much the underlying unmet needs, right? Underlying unmet needs. So this could be a child who is feeling tired, a child who is hungry, a child who is stressed and needs to be comforted, a child who is overstimulated, and a child who is understimulated. So this would be a child who is bored. Understanding these factors will enable us to pick up when the child is having a tantrum, and it will give us a reason as to why the child is having a tantrum. So the third trigger or common cause for tantrum is that there could be an underlying mental health issue. A sign that your child is undergoing a mental health issue is when the tantrums are intense. So, meaning the amount of time to calm down takes really long, or it is when the tantrums are frequent. So, this would be more days than not. And then when there's an interference in terms of the functioning, and when you have multiple settings where the child is with different caregivers and you find that tantrums are often most likely to occur. This is when you would find that you might need to then reach out to a professional. So, examples of mental health issues could be anxiety, depression, ADHD, trauma, autism spectrum disorder, specific learning disability, sensory processing disorders. Right? So, if you have concerns about your child's tantrums, then now would be a good time to consult with a pediatrician or mental health provider. The fourth trigger or cause for tantrum would be temperament. So, your child's personality influences how quickly and how strongly they react to changes in their routine or in their environment. So, meaning children who get upset quickly are most likely to display tantrums, right? And the fifth one is that when you set a boundary, or when there are limits, or when you say no to your child, this is most likely to result in a tantrum because you are setting limits, you are saying no, and this just goes against what they might be looking for at that time. Yeah. So, pretty much what then signals the reason for tantrums is that they signal an underlying developed skill, right? So it's an underdeveloped skill that still needs to be developed. So we're looking at self-soothing, problem solving, delaying gratification, communication as well as communication. So, this is just an introduction to what tantrums are, and just for us to have a definition of what they are so that we can have an understanding. What I will do then in later videos is actually dig deeper into some of the common triggers, because there is a lot of detail that is quite important for us to know, and I will cover this in other videos. But I hope that this for now has given you a good understanding of what tantrums are and what the common triggers might be. Thank you for watching and staying with me till the end. I appreciate your time, and I look forward to seeing you in the next video. But until then, please make sure that you like the video, you click the notification bell so you can be notified of future uploads, and you share with your community that would be in need. I thank you for your time, and I'll see you in the next video. Take care.